Question 1. In light of recent developments in radiopharmacy, consider the situation where Optismith is preparing a radiopharmaceutical for a patient undergoing a SPECT scan. The radiopharmaceutical has been obtained from a reputable supplier, but Optismith notices that the product is nearing its expiration date. The patient is scheduled for the scan later in the day. What should Optismith do in this situation? A. Proceed with the preparation and administer the radiopharmaceutical since it is only slightly past the expiration date. B. Discard the radiopharmaceutical and request a new batch as it is close to the expiration date. C. Use the radiopharmaceutical but reduce the administered dose to compensate for the reduced potency. D. Proceed with the preparation but inform the patient about the potential risks associated with using expired material. Answer. Correct answer. B. Explanation. In nuclear medicine, quality control is a crucial component of radiopharmacy. The expiration date on radiopharmaceuticals is determined based on stability, potency, and safety concerns. It is not advisable to use expired products as their effectiveness may be compromised and there could be potential risks related to safety, according to the European regulations on radiopharmaceutical quality control. G. European Pharmacopoeia, a radiopharmaceutical should only be used within its specified shelf life. Discarding expired radiopharmaceuticals ensures patient safety and compliance with regulatory standards. Question 2. Which of the following is a common characteristic of the radiation emitted by iodine 131 in diagnostic nuclear medicine procedures? The high-energy gamma radiation suitable for imaging but requiring lead shielding. B. Alpha radiation, which is absorbed by body tissues and is not useful for imaging. C. Beta radiation, used for therapeutic purposes and not effective for imaging. D. Low-energy gamma radiation, ideal for imaging with minimal shielding required. Answer. Correct answer. Explanation. Iodine 131 or 131 is commonly used in both diagnostic and therapeutic nuclear medicine applications. It emits high-energy gamma radiation, which makes it suitable for imaging techniques such as scintigraphy. The high-energy gamma rays are detected by gamma cameras, enabling clear imaging of the thyroid or other targeted areas. However, because of its high energy, appropriate shielding, e.g., lead, is necessary to protect healthcare workers and patients from unnecessary radiation exposure. This is in line with radiation protection standards as outlined by the International Atomic Energy Agency (IAEA). Question 3. Mr. Johnson is undergoing a PET scan to assess the metabolic activity of a suspected tumor. He has administered 18 FDG as a radiotracer. In terms of tracer kinetic modeling, what primary factor will affect the distribution of 18 FDG in the tumor tissue? A. The rate of blood flow to the tumor. B. The patient's metabolic rate during the scan. C. The molecular weight of 18 FDG. D. The type of imaging equipment used in the scan. Answer. Correct answer. A. Explanation. In PET imaging, the distribution of radio tracers like 18 FDG is heavily influenced by the tumor's blood flow. Tumors with high metabolic activity often exhibit enhanced blood flow, which facilitates higher uptake of the tracer. The rate at which the radiotracer is metabolized and distributed within the tissue depends significantly on this blood supply. Tracer kinetic modeling involves analyzing these factors to evaluate the tumor's metabolic activity, with primary focus on perfusion and uptake rates as outlined in the Principles of Nuclear Medicine and the Guidelines for PET Imaging. Question 4. Which of the following scenarios best demonstrates the concept of radiation protection in the context of nuclear medicine? A. A radiologist wears a lead apron during all procedures involving radiopharmaceuticals. B. A patient undergoes a series of imaging tests without considering the cumulative radiation dose. C. A technologist minimizes exposure by operating the imaging equipment from a distance. D. A physician administers the highest dose of radiopharmaceutical to ensure the best diagnostic outcome. Answer. Correct answer. C. Explanation. Radiation protection principles are fundamental in nuclear medicine to minimize radiation exposure to both healthcare workers and patients. One key principle is distance, which helps reduce exposure. Operating imaging equipment from A safe distance and using appropriate shielding are essential practices to reduce unnecessary radiation exposure, according to the ICAP International Commission on Radiological Protection guidelines. Radiation protection should aim to minimize exposure while ensuring that diagnostic information is still obtained effectively, using the minimum necessary radiation dose and following the ALARA as low as reasonably achieved. Principle are key components of radiation safety. Question 5. Taking into account recent advancements in radiochemistry, how should a radiopharmacist ensure the quality of a radiopharmaceutical batch before it is dispensed for clinical use? A. Verify the radiopharmaceutical's shelf life and ensure it has not been exceeded. B. Perform a visual inspection for any signs of contamination such as discoloration or particles. C. Conduct a sterility test if the radiopharmaceutical is for intravenous administration. D. All of the above. Answer. Correct answer. D. Explanation. The quality control of radiopharmaceuticals is a multifaceted process that involves verifying the product sterility, ensuring it is within its shelf life, and visually inspecting for any contaminants, according to the European Pharmacopoeia and Good Manufacturing Practice (GMP) guidelines. Radiopharmaceuticals must be free from any physical, chemical, or microbial contaminants. Additionally, the state of the product is crucial, especially when the radiopharmaceutical is being administered intravenously. Performing these checks ensures the safety, effectiveness, and compliance of the product with relevant regulatory standards. Question 6. The efficacy of nuclear medicine imaging, particularly in oncology, can be significantly influenced by the following aspect: A. The patient's age and gender. B. The type of radiopharmaceutical used in the procedure. C. The imaging modality used, such as ET or MRI. D. The patient's hydration level during the scan. Answer. Correct answer. B. Explanation. The choice of radiopharmaceutical is a critical factor in the efficacy of nuclear medicine imaging, especially for oncology patients. Different radiopharmaceuticals target specific biological processes such as metabolism, receptor binding, or blood flow. For example, 18-FDG is often used in PET scans to assess metabolic activity in tumors. The radiopharmaceutical's binding affinity, half-life, clearance from the body all affect the quality of the imaging results and diagnostic accuracy. Thus, selecting the correct radiopharmaceutical tailored to the specific diagnostic need is crucial for optimal imaging outcomes. Question 7. From a clinical standpoint, which of the following principles is central to the selection of patients for radionuclide therapy in treating neuroendocrine tumors, NETs? A. The absence of distant metastases in the patient's medical history. B. The presence of specific somatostatin receptor expression on the tumor cells. C. The patient's preference for non-invasive treatment options. D. The general age of the patient, with older patients excluded from therapy. Answer. Correct answer. B. Explanation. The central principle in selecting patients for peptide receptor radionuclide therapy or neuroendocrine tumors is the presence of specific somatostatin receptors on the tumor asset or T is based on the targeting of these receptors, allowing the radiopharmaceutical to selectively bind to tumor cells and deliver therapeutic radiation. This treatment has been shown to be highly effective in patients with NETs. Express somatostatin receptors, as evidenced by clinical guidelines and studies on the efficacy or T in treating such tumors. Question 8. Mr. Turner is experiencing a suspected myocardial infarction. His physician orders a myocardial perfusion SPECT scan to assess the extent of the damage. What physiological factor is most likely to influence the results of this scan? A. The patient's body temperature during the scan. B. The level of myocardial blood flow during the scan. C. The type of imaging camera used in the procedure. D. The patient's recent food intake prior to the scan. Answer. Correct answer. B. Explanation. In myocardial perfusion SPECT, the primary factor influencing the results is the level of myocardial blood flow during the scan. Areas with decreased blood flow, often due to blockages in coronary arteries, will show up as cold spots on the scan. The radiopharmaceutical used in this test, G. Technetium-99 meters CertMedbry is taken up by the heart muscle in proportion to blood flow, providing detailed images of areas affected by ischemia or infarction. Other factors like body temperature or food intake have minimal impact on the results of this procedure. Question 9. When evaluating a patient's eligibility for selective internal radiation therapy (SIR) for liver tumors, which of the following is an essential consideration? A. The patient's age and general health. B. The presence of hepatic arterial blood flow to the tumors. C. The presence of metastases in organs other than the liver. D. The patient's previous treatment history with radiation therapy. Answer. Correct answer. B. Explanation. Selective internal radiation therapy (SIRT) requires that the liver tumors have adequate blood supply from the hepatic artery. The procedure involves the administration of radioactive microspheres through the hepatic artery, which then embolize the tumors and deliver localized radiation. Tumors with poor or absent arterial supply may not respond to SIRT, making it an essential criterion for patient selection. This is supported by clinical guidelines and studies in nuclear medicine that emphasize the importance of tumor vascularity for the success of SIRT. Question 10. How might one explain the use of radiation protection measures for staff in a nuclear medicine department, especially when handling high-energy radiation sources? A. Using lead aprons to shield staff from radiation exposure. B. Limiting staff exposure by reducing the number of patients seen per day. C. Administering higher doses to the patient so that the staff is less exposed to radiation. D. Wearing dosimeters to track and limit personal radiation exposure. Answer. Correct answer. D. Explanation. The most effective way to protect nuclear medicine staff from radiation exposure is to use dosimeters, which track the amount of radiation a worker is exposed to. This allows for continuous monitoring and ensures that exposure stays within safe limits. Additionally, personal protective equipment, such as lead aprons and adherence to the ALARA, as low as reasonably achievable principle are essential, but dosimetry direct feedback on staff exposure. Regulatory standards, including those from the ICAP and the European Commission, emphasize the importance of radiation monitoring in ensuring the safety of healthcare professionals. Question 11. When evaluating a patient's suitability for selective internal radiation therapy (SIRT), which factor is most critical to consider in order to avoid potential complications? A. The patient's renal function. B. The tumor's response to chemotherapy. C. The patient's liver function and tumor vascularity. D. The patient's age and overall fitness. Answer. Correct answer. C. The patient's liver function and tumor vascularity. Explanation. In SIRT, the primary factor for patient selection is assessing liver function and tumor vascularity, as the therapy involves delivering radioactive microspheres directly into the liver tumor's blood vessels. A compromised liver function can impair the effective delivery of the therapy, and the tumor's vascularity determines whether the microspheres can be effectively localized within tumor tissue. Guidelines from the European Society for Radiotherapy and Oncology (ESTRO) and the European Association of Nuclear Medicine (ENM) stress these factors for optimal treatment planning. Question 12. In a patient undergoing 18th FDG PET for the assessment of a suspected brain tumor which normal variant might cause, a false positive result: A. Physiological uptake in the white matter of the brain. B. Increased uptake in the area of the thalamus. C. Physiological uptake in the brown fat tissue. D. Physiological uptake in the hippocampus. Answer. Correct answer. A. Physiological uptake in the white matter of the brain. Explanation. 18th FDG PET imaging detects metabolic activity, and physiological uptake is often seen in the white matter, which could potentially cause a false positive in brain tumor imaging. This is due to the inherent metabolic activity of the brain's white matter, which can overlap with abnormal tumor uptake. Careful interpretation of the imaging, considering anatomical, physiological variations, is essential to avoid misdiagnosis. This is highlighted in ENM guidelines on PET imaging for oncology. Question 13. Considering the role of radiopharmaceuticals in thyroid scintigraphy, which of the following would most likely be used to assess a hyperfunctioning thyroid nodule? A. 99 Nc per technetate. B. 123 iodine, C. 18 for FDG, D. 67 gallium. Answer. Correct answer, B. 123 iodine. Explanation. 123 iodine is commonly used in thyroid scintigraphy to assess hyperfunctioning thyroid nodules due to its high specificity and affinity for thyroid tissue. The iodine isotope undergoes minimal decay, providing clear imaging for evaluation, according to the American College of Radiology (ACA) and the Radiological Society of North America (AST) guidelines. Iodine-based tracers are preferred for thyroid imaging over 99 mg per technetate, which is used more for other conditions like thyroid carcinoma staging. Question 14. During a PET scan for the evaluation of myocardial viability, which of the following would be the most appropriate radiopharmaceutical for assessing myocardial glucose metabolism? A. 18-fluorodeoxyglucose 18F-G, B. 99 CertMedbry, C. 68 dotatate, D. 123 mg. Answer. Correct answer, A. 18-fluorodeoxyglucose 18F-G. Explanation. 18F-DG PET is widely used for evaluating myocardial glucose metabolism, especially in the assessment of myocardial viability in ischemic heart disease. The glucose uptake by viable myocardial tissue is often increased, which helps in identifying areas of ischemia or viability in a post-infarct heart. The European Association of Nuclear Medicine (ENM) and the American College of Cardiology (AC) recommend 18F-DG for assessing myocardial viability in patients with coronary artery disease or left ventricular dysfunction. Question 15. In the context of molecular imaging for neuroendocrine tumors, which imaging modality is most commonly employed for somatostatin receptor imaging? A. 18F-DG PET, B. 68 dotatate PET, C. 99 CertMedbry SPECT, D. 123 iodine SPECT. Answer. Correct answer, B. 68 dotatate PET. Explanation. 68 dotatate PET is the gold standard imaging modality for evaluating neuroendocrine tumors due to its high specificity and sensitivity for detecting somatostatin receptors, which are commonly overexpressed in neuroendocrine tumor cells. This approach allows for accurate staging and evaluation of metastatic disease. The European Society for Nuclear Medicine and the ENM have endorsed the use of 68 dotatate for this purpose. Question 16. Given the recent advancements in artificial intelligence in nuclear medicine, which of the following best describes its current application? A. AI is used for automating the preparation of radiopharmaceuticals. B. AI is employed in image reconstruction and enhancing the quality of scans. C. AI is exclusively used for radiation therapy planning. D. AI is used to provide clinical diagnosis directly from images without human oversight. Answer. Correct answer, B. AI is employed in image reconstruction and enhancing the quality of scans. Explanation. Artificial intelligence is increasingly being integrated into nuclear medicine for enhancing image quality, especially in PET and SPECT scans, by improving image resolution, reducing noise, and enabling faster processing. AI algorithms also aid in automating the identification of abnormalities in images. However, while AI has made significant progress, clinical decisions still require human oversight. This is emphasized by the latest guidelines from the European Nuclear Medicine Association (ENMA). Question 17. A patient undergoing a bone scintigraphy scan for possible metastatic disease presents with a high background uptake in the region of the iliac crest. What is the most likely cause of this increased uptake? A. Artifact due to patient movement. B. Increased uptake due to inflammation or infection. C. Physiological uptake due to normal bone remodeling. D. A false positive due to poor radiopharmaceutical handling. Answer. Correct answer, C. Physiological uptake due to normal bone remodeling. Explanation. Bone scintigraphy often shows physiological uptake in areas of active bone remodeling, such as the iliac crest, particularly in young or postmenopausal individuals. This is typically due to normal bone turnover and not necessarily a sign of metastatic disease. The ENM guidelines stress the importance of distinguishing between physiological and pathological uptake patterns during the interpretation of bone scans to avoid misdiagnosis. Question 18. What is the main advantage of using PETRI compared to PECT in the evaluation of soft tissue tumors? A. PETRI provides better bone imaging than PECT. B. PETRI has superior soft tissue contrast and can provide better anatomical delineation. C. PETRI has a shorter scan time than PECT. D. PETRI is less expensive than PECT. Answer. Correct answer. B. PETRI has superior soft tissue contrast and can provide better anatomical delineation. Explanation. PETRI combines the metabolic information from PET with the high soft tissue contrast of MRI, making it particularly advantageous in the evaluation of soft tissue tumors. This modality excels at identifying tumor boundaries and assessing the relationship between the tumor and surrounding tissues. In contrast, PECT is better, assessing bony structures and anatomical landmarks. Guidelines from the EBNM and Society of Nuclear Medicine highlight the role of PETRI in soft tissue tumor evaluation. Question 19. Which of the following imaging techniques is most commonly used for evaluating renal function in the context of a suspected obstructed kidney? A. 99 DOPA renal scintigraphy. B. 123 iodine thyroid scan. C. 18 feeder GPEC. D. 99 itch pow spect. Answer. Correct answer. A. 99 DOPA renal scintigraphy. Explanation. 99 DOPA renal scintigraphy is the preferred imaging technique for evaluating renal function and diagnosing urinary tract obstruction. The tracer is filtered by the kidneys and its clearance can be measured to assess the presence of obstruction. The EBNM and European Urological Association (EUA) guidelines recommend this technique for both assessing renal function and determining the severity of obstructions, as it provides dynamic functional imaging. Question 20. In the context of radiation protection during a nuclear medicine procedure, which of the following is the most critical principle to minimize radiation exposure to healthcare workers? A. Use of high-energy radiopharmaceuticals to decrease exposure time. B. Adherence to the ALARA as low as reasonably achievable principle for dose optimization. C. Frequent monitoring of radiation exposure through personnel badges. D. Use of lead aprons during every procedure. Answer. Correct answer. B. Adherence to the ALARA as low as reasonably achievable principle for dose optimization. Explanation. The ALARA principle is the cornerstone of radiation protection in nuclear medicine, emphasizing the minimization of radiation exposure while achieving diagnostic quality. This involves optimizing protocols, using shielding, reducing exposure time, and ensuring adequate distancing. The International Commission on Radiological Protection (ICOP) and EBNM guidelines highlight this approach as essential for protecting healthcare workers and patients alike. Lead aprons and personnel badges are important but secondary to the ALARA principle. Question 21. Which of the following is the primary disadvantage of using 1850 GPECT in the assessment of lung cancer? A. It may result in false negative results in patients with small tumors. B. The patient is exposed to a higher dose of radiation compared to other imaging modalities. C. It cannot detect tumors in patients with obstructed airways. D. It has poor specificity due to physiological uptake in the brain. Answer. Correct answer. A. It may result in false negative results in patients with small tumors. Explanation. 18th FDG-PECT is highly sensitive, but it can miss small tumors, especially in the early stages of lung cancer. This is due to the relatively low metabolic activity of small lesions, which may not accumulate enough FDG to be detected. According to the European Society of Medical Oncology (ESMO), careful clinical correlation is needed, especially for small and early-stage lung cancers. Question 22. In the context of nuclear medicine for thyroid cancer imaging, which radiopharmaceutical is most commonly used for detecting distant metastases? A. 131 iodine. B. 18 FDG. C. 123 iodine. D. 99 pertechnetate. Answer. Correct answer. B. 18th FDG. Explanation. While 130-iodine is commonly used for assessing thyroid function and treating thyroid cancer, 18-FDG is the preferred choice for detecting distant metastases, especially in cases of differentiated thyroid cancer with aggressive behavior or when iodine uptake is absent. FDG-PECT is sensitive for identifying metabolic activity in metastatic lesions. This is recommended by the European Association of Nuclear Medicine (EBNM). Question 23. Which imaging modality is preferred for evaluating brain metastases in patients with non-small cell lung cancer (SLC)? 18-FDG PECT, B 123 iodine SPECT, C MRI brain without contrast, D 68G dotatate PECT. Answer. Correct answer, C MRI brain without contrast. Explanation. MRI is the gold standard for evaluating brain metastases due to its superior soft tissue contrast, which allows detailed imaging of the brain parenchyma. For non-small cell lung cancer, brain metastases are common. MRI without contrast is typically used to assess the presence, number, and location of lesions. The American Society of Clinical Oncology has screened MRI for this purpose in metastatic lung cancer. Question 24. What is the primary advantage of using 18-FDG PECT in the evaluation of colorectal cancer (ERC)? A. It provides high-resolution images of liver metastases. B. It allows for the assessment of tumor molecular characteristics. C. It can detect recurrent disease early, even before other imaging techniques. D. It is less expensive than conventional imaging methods. Answer. Correct answer, C. It can detect recurrent disease early, even before other imaging techniques. Explanation. 18-FDG PECT is highly effective for detecting recurrent colorectal cancer, especially in cases of elevated tumor markers, e.g. The ability to detect metabolic changes before structural changes make FDG PECT valuable in monitoring patients post-treatment. This early detection of recurrence can influence subsequent therapeutic decisions. Guidelines from the European Society for Medical Oncology (ESMO) emphasize its role in post-therapy monitoring. Question 25. In the evaluation of prostate cancer, which of the following radiopharmaceuticals is most commonly used in PET imaging to detect biochemical recurrence? A. 18-FDG, B. 11-choline, C. 68-PSMA, D. 99-MD. Answer. Correct answer, C. 68-PSMA. Explanation. 68-PSMA PECT has revolutionized the detection of biochemical recurrence in prostate cancer, particularly in patients with rising PSA levels after primary treatment. The prostate-specific membrane antigen PSMA is overexpressed on prostate cancer cells, making PSA-targeted imaging highly sensitive for detecting small metastatic lesions or recurrence. This is endorsed by the European Association of Urology. Question 26. When conducting 99H-MISH-POW SPECT scan to assess brain perfusion, which of the following is an important consideration? A. It provides high-resolution imaging for detecting small infarctions. B. It is particularly useful in evaluating brain tumors with heterogeneous blood flow. C. It is contraindicated in patients with prior head trauma. D. It can distinguish between gliomas and metastases. Answer. Correct answer, B. It is particularly useful in evaluating brain tumors with heterogeneous blood flow. Explanation. 99H-POW SPECT is used for evaluating brain perfusion, particularly in cases where there are areas of heterogeneous blood flow, such as in brain tumors. This helps to identify areas of decreased perfusion, which can be indicative of tumor hypoxia or necrosis. It is commonly used to assist in the management, planning of radiotherapy for brain tumors. The European Society of Nuclear Medicine (EBNM) recommends this modality for tumor perfusion studies. Question 27. In a patient with suspected Alzheimer's disease, which radiopharmaceutical is commonly used in PET imaging to assess amyloid plaques? A. 18-FDG, B. 11-PIB, C. 68G dotatate, D. 123 iodine. Answer. Correct answer, B. 11-PIB. Explanation. 11-PIB Pittsburgh Compound B PET imaging is specifically designed to assess amyloid plaques in the brain, a hallmark feature of Alzheimer's disease. This radiopharmaceutical binds to amyloid plaques, allowing for visualization of their distribution in the brain. Its use in clinical practice for Alzheimer's diagnosis has been endorsed by both the Alzheimer's Association and the Society of New Medicine and Molecular Imaging (SMM). Question 20. In a patient with suspected metastatic breast cancer, which imaging technique is preferred to evaluate the extent of skeletal involvement? A. 99 mdp bone scintigraphy. B. 1850 GPET. C. MRI of the spine. D. 123 iodine SPECT. Answer. Correct answer. A. 99 mdp bone scintigraphy. Explanation. Bone scintigraphy with 99 mdp is the preferred imaging modality for evaluating skeletal metastases in patients with metastatic breast cancer. It is sensitive for detecting early bone involvement, including both lytic and blastic lesions, and provides a whole-body survey in a single scan. The European Association of Nuclear Medicine (EBNM) and the Society of Clinical Oncology (ESCO) recommend bone scintigraphy as a first-line imaging technique in the evaluation of bone metastases. Question 29. Which of the following factors is most important to assess when determining the suitability of a patient for radiotherapy in the treatment of head and neck cancers? A. The tumor's histological grade. B. The patient's functional status and comorbidities. C. The patient's response to prior chemotherapy. D. The tumor's location and size. Answer. Correct answer. B. The patient's functional status and comorbidities. Explanation. In the treatment of head and neck cancers, the patient's overall health, functional status, and comorbidities are critical factors when determining suitability for radiotherapy. The impact of radiation on swallowing, speech, and other vital functions must be considered. The European Society for Radiotherapy and Oncology (ESTRO) provides comprehensive guidelines, patient assessment prior to treatment. Question 30. Which imaging technique is most effective for detecting recurrent disease in patients with endometrial cancer after surgery? A. 18th GPET. B. MRI pelvis. C. 99 CertMedbry SPECT. D. 68 dotatate PECT. Answer. Correct answer. B. MRI pelvis. Explanation. MRI pelvis is the gold standard imaging technique for detecting recurrent disease in patients with endometrial cancer, particularly in the pelvic region. It provides high-resolution soft tissue contrast, which is essential for identifying local recurrence. The European Society of Urological Oncology (EWO) and the EBNM emphasized the importance of MRI in post-operative surveillance endometrial cancer.